So welcome to NASPAC.
I think it's not yet. Or is it?
Good evening, everybody. Welcome to NASPAC's Facebook Live webinar on medical marijuana. My name is Dr. Kieran Slevin, co-founder and CEO at North American Spine and Pain Consultants. Joined here by David Nguyen, our Director of New Market Development. And together we're going to spend an hour with you this evening discussing medical marijuana, how it's available in the 3 states that we currently provide services in, New Jersey, Delaware, Pennsylvania. And we'll have some education for you guys in on how the process works, how you can access medicinal marijuana in your location. And then we'll open up the floor for live questions and answers. So looking forward to a lively, robust session with everybody this evening. Thanks for joining us.
Thank you.
So one of the first things obviously we want to get out there is medicinal marijuana and the indications. So specifically what it's useful for. And a lot of the data has shown over the years that the actual THC and CBD receptors, right? So we have two areas, two versions of how this product works. One is THC, one is CBD, and we can provide all patients with access to both combined. We can provide CBD on its own. So there's a real variety of options available for all patients out there, no matter what your chronic pain or other condition may be that renders you a suitable candidate for medicinal marijuana. So on that, there are, in each state, approximately 12 to 16 indications. And what that is a reason or an appropriate diagnosis that makes you a good candidate for medicinal marijuana, as directed by each of the 3 states. Again, we're in New Jersey, Pennsylvania, and Delaware. Slight subtleties between each one, but for the most part, and essentially all patients with chronic pain, that is pain greater than 3 months duration, are appropriate candidates for medicinal marijuana in all 3 states. So if your problem is chronic pain and you're having a hard time dealing with it, then medicinal marijuana may well be something that's of interest for you, and hopefully we can shed some light on the process and what strains, etc., may be available and be helpful for you tonight. So first step obviously is to make an appointment, come in, get seen, have an encounter, have a visit in person with a physician. And what we do at that setting is review everything for you in terms of what your diagnoses are if you've got more than one. A lot of patients do. Make sure that they are par with the state's guidelines for medicinal marijuana. We then conduct standard history, physical examination. We explain to you the process, right? And what that involves is registering with the state. The physician will certify you, and essentially that's a legal contract with the state that says that you are an appropriate candidate for medicinal marijuana. So a registered physician needs to make that assessment. So assuming you meet the criteria, and many of you can access the criteria for your state online. If you go to, you can Google, in New Jersey, it's nj.mmp.gov is the website, and you'll get a whole host of information there in terms of appropriate diagnoses that would make you a good candidate. So once you're certified, the process to actually get the card in hand, which is what you need before you go to the dispensary, takes approximately 2 weeks. So with what we've all been through in the last year with this ghastly pandemic, bear in mind that, and the holidays upon us, the actual time for getting the card in hand from when you see the physician may be slightly longer, upwards of 2 to 3 weeks. But certainly within a month, every patient has their card. Once you have the card in your hand, you can go to any local dispensary in the state where medicinal marijuana is available. And at that first visit, it's where the staff there will spend some time. They'll do whatever education they can. Our experience, based on what patients tell us, is that in many situations, these pharmacies and dispensaries are super crowded, have long waits, and have relatively limited availability to actually spend time with the patient to explain to them what type of medicinal marijuana is available, how much you can take, how often you should take, and most importantly of all, what strains you should be using. Because there's a vast array of strains, as we know. There's hybrids, which is a combination of the 2 main types of marijuana, indica and sativa. So with that being said, we have introduced a program here that's been in operation for over a year and has been highly successful, which David is spearheading. And he and his team communicate with the patients, outreach to patients, make calls, walk you through the process, can speak to you on specific strains to identify what may be most helpful in your particular situation. So great resource, tremendous resource here at NASPAC and David Nguyen and his team to help get patients through what can be, a fairly difficult, challenging process, not just with all of the paperwork and documentation that needs to get sent in, but more importantly, trying to identify what strain is going to work for your condition. So once you have the card in your hand, you go to the pharmacy, you are given some product, right? You have at that point make the decision in terms of whether or not your choice is to use whether you want to do edibles. There are gummies and lozenges available in most of the 3 states in this area. There is also flower, which is your standard marijuana bud. There are vape forms available. There's combinations of the two. In Pennsylvania, tinctures are available. And there's also oil that can be used to mix with food or to make butter, to cook. Many patients find that ingesting the medicinal marijuana through the GI tract, through the stomach, avoids side effects from smoke, etc., inhalation. We're obviously sensitive to those topics and trying to limit patients' unnecessary exposure to smoke. So this all sounds great, I know you're thinking. Now, obviously, what is the cost? There's always a cost to any of these sort of services and programs that are available. So in all 3 states, we charge $200 to certify you at your first visit. That will get you essentially between 6 to 12 months of coverage. That means that your prescription may not need to be refilled for anywhere between 6 to 12 months, depending on what jurisdiction you're in. There's some slight variations based on whether it's Pennsylvania versus Delaware. In New Jersey, it's $200 first visit. Then 6 months later, you pay $100 and $100 every 6 months thereafter. That covers the cost of the program, allows us to remain cost neutral, and allows us to provide the many services that we do for all of our NASPAC community of patients. At that point, once you register yourself, and after you have your visit with the physician, you leave. We give you the information that you need to go to the website. Like I said earlier, it's njmmp.nj.gov, and you go and you look for the new patient registration. You take the information that we've given you, which is called reference number. And there's slight variations in Delaware and Pennsylvania where it's done via pen and paper. But in New Jersey, everything is done electronically. So you then, as the patient, log in. You upload and verify your information, including ID, whether it's a driver's license or passport. It just has to match the address that you've given the physician. So in order that the state can show the address you're given is really you and that the person who's getting the card is really you. And there's also a requirement that you send information regarding a utility bill, so it can be a cell phone or mortgage or gas or bill or some type of utility, so that again it's the very basic confirmation of your identity. So once you get the registration piece, that's when the card comes, approximately 2 to 4 weeks as discussed, and that period of time is when we do all the education with you as a patient. We let you know about the types and varieties of CBD, THC that are available in our entire suite of services, whether it's we have a balm, a roll-on that's highly effective. Dave's going to speak to this slightly later. I have a personal experience using the CBD balm. About a year ago, I had a mountain bike accident and broke 2 ribs. And as many of you know, there's really nothing you can do for broken ribs other than wait it out. And it's quite uncomfortable, taking deep breaths, etc., etc. So I found it particularly useful just to rub this CBD balm on from time to time. No side effects, no drowsiness, nothing systemic. Doesn't do anything to your neuro abilities or your cognitive function, and was super useful. So we'll hear more about that from Dave. But this whole period of 2 to 4 weeks while we're waiting for your card to come in is when we get you involved in the program and start to do the education that's key for getting you across the next step in this process. So I'm going to hand over to Dave for some more information on his team's educational instructions that you can expect when you become a NASPAC MMP patient.
Perfect. Thank you, Dr. Slevin. So as stated, my name is David, and you can always contact me directly. In the chat, we'll throw up my contact information and email if you ever have any questions. But basically, just like Dr. Slevin said, I will basically take over after you do get approved by Dr. Slevin or any of our other providers, and I will handle all of the educational stuff regarding products, how to take them, dosing guidelines, and basically just advice and recommendations to start you off. in between the time that's very crucial, and that time period is basically after you get the reference ID and you're registering and waiting for the card, all the way up until the time that you get to your first dispensary visit. And also along those lines as well, we want to help you with your journey, and I always invite patients to call me on a monthly basis. Think of me as kind of on call. You can call me with any questions and everything, because starting into medical marijuana, whether you have or haven't tried it before in your youth or in your past, it is a very, very different animal nowadays. And especially if you go from, say, a recreational standpoint to a medicinal standpoint, it is completely different. You're no longer taking it to feel something. Now it has to be used specifically for a certain feeling, whether it's chronic pain or insomnia or depression or what have you. You are looking to treat a specific ailment, and also it's not covered by insurance, so we really want to work you down to what I call kind of a magical formula, which is you want to know on a monthly basis how much you need to spend and how long it's going to last and how it's going to attribute to your medical ailments. So just like Dr. Slevin said, for those, even if you've done a lot of research on your own before going to the dispensary, it can be very, very overwhelming. The lines can be long, it can be crowded, and depending on which dispensary it is, you're going to get a range of experience with the staff that you speak to. Some of them might just be there to just tell you the specials. Some of them might be talking from personal experience, and some of them might also know their stuff. And it's very, very important to distinguish between all of these, because not every person is the same. And let me tackle that kind of just one by one. So the first thing is tolerance with regular pharmaceutical medications is not tolerance with medical marijuana. And Dr. Slevin can speak more about this as well. So I've spoken to a number of patients who are either on the high strength of one pharmaceutical medication, and then they immediately think that they need to go to the dispensary and purchase the high strength marijuana product. And then it kind of blows them away. They get too impaired, they get too high, as they call it, and it kind of deters them from ever going into the program again. And this is after you've paid the fee and spent the time waiting. So we want to make the journey as easy as possible for you, so that you run into the least amount of hurdles as necessary. The other thing, just like Dr. Slevin mentioned, I'll go over kind of an entire overview of medical marijuana with you, and that's talking to you about the different types of strains, like the different categories of strains, distinguishing between sativa, indicas, and hybrids, when to take them, when to not take them, the different strains specifically, like whether it's, say, an OG Kush or Granddaddy Purple or Blue Dream, names that sound really funny, but it's basically just designating a different chemical breakdown, and that's designating a different ratio of cannabinoids and also a different terpene profile for you as well, which is going to affect every single person ever so slightly different to vastly different as well. And then the other point that I wanted to touch on is the types of products, right? So Dr. Slevin had mentioned the 5 general types of products that you will find in dispensaries. You have flower and vape, which you'll smoke, whether it's in a flower, like a bud form, or like a smokable oil form. You'll have tinctures, which are the oils that you can apply sublingually or mix in with food or drink. You'll have edibles, which is just pre-made food with the marijuana in it. And then you'll have topicals, which can be applied locally like a roll-on balm or a lotion or cream. One of the things to be very mindful about that is basically the first 4 kind, the flower, the vapes, the tinctures, and the edibles, because you're either inhaling or you're eating them. They will give you a systemic reaction, whereas with a topical, it's going to give you a localized reaction because you're applying it directly to an area on your body. And then the other thing to really know about is rule of thumbs with all the different types of products before I get into anything else. So very, very important to note that with smoking, on average, a rule of thumb to remember is that you will get the effects or feel the effects in about 15 to 20 minutes, give or take, and they'll last around maybe 3 to 4 hours. With edibles, especially solid foods, they follow the same kind of guidelines as if you were taking kind of pills before dinner or on an empty stomach or what have you. So with edibles, Depending on how fast your body digests food, you won't feel them until about 30 to 45 minutes, say on an empty stomach, or around maybe 45 minutes to an hour, even more, if you've just taken it after a meal. So very, very important to note when to expect the effects based on what type of product that you're taking. With topicals, depends on the types of topicals, but usually around like the 15 to 20 minute mark. And then with topicals, really depends on how active you are. Say like if I just apply a topical and I went down the mountain for a bike ride, probably not going to last as long as say if I just applied and kind of sat down and took a rest there. So keep those in mind, and I always encourage patients to make a journal entry of everything, because not everyone's going to be the same, not everyone's going to be affected the same, and it's comes down to one thing called your endocannabinoid system. So basically this is what dictates how your body processes the cannabinoids, and in some cases some terpenes as well. I can tell you with a guarantee that if Dr. Slevin and I sat down and we smoked maybe 20, 30, say 50 strains, we're not going to feel 100% the same way. Dr. Slevin might be passed out. I might be wide awake. I might get the munchies. Dr. Slevin might have a loss of appetite.
You'll see at the end of the broadcast. That's when we're going to do that.
And that's just because how our body processes it. So the other thing, in addition to that, is you want to be very, very mindful of any sort of health risk that you have before taking medical marijuana and or hemp-based CBD products. So for instance, a really good example is say a patient didn't know that, say they had maybe like a lung-related issue, I don't know, asthma that they never knew about, or maybe just problems like digesting food or what have you. So if it's a respiratory problem and their preferred method was smoking, and they're just puffing day in and day out and wondering why they're not getting any sort of effects, that's probably why, right? Because a potential health risk is basically getting in the way. On the same token, if your body is digesting food at a slower rate than average, then when you take edibles, you need to be mindful of that as well, and make sure that you don't take too much, or maybe double or triple the dose when you don't need to. One thing to mention to kind of piggyback off of that is we do have one thing. It's called strain gening. It's a DNA test that basically tests your endocannabinoid system. It's a really quick cheek swab, and rather than kind of going through what we would call like a trial and error process, which for some patients it works for them and they kind of find the products really quickly, but if you find that you're having some trouble, or maybe you just want to get down right to the bottom of it, what you can do is just take the test. We offer it here. It's $250 for the kit. And then you get your results in about 2 to 3 weeks. You review it with both of us, your provider and also myself. We go over the physical health portion side of things, and then also the medical marijuana and the CBD side of things. And basically what it gets you is it analyzes all your potential health risks. It lets you know specifically what strains and why, because of like the different ratios in THC, CBD, maybe your body needs a little bit of other cannabinoids like CBG or CBN, what have you, and also the types of products. So it basically gets you from point A to point B pretty much immediately, and you'll know what to take, and you'll kind of get right down to the bottom of it. And then and then the last thing that I do want to cover before we open it up to questions is just the CBD portion side of things. So just like Dr. Slevin mentioned, CBD, like hemp-derived CBD, is basically products like, it's the same thing that you can find off the shelf or online or what have you. We have our own product as well, but CBD is basically kind of the opposite in some ways to THC, which is found in all marijuana products, whereas THC will have the potential to make you feel impaired or high or loopy, however you want to call it. CBD doesn't have any of those risks, but it also carries a lot of medical benefits as well. So at our clinic, we have a CBD product. It's called Sana. It's a roll-on balm. It uses pharmaceutical grade CBD, which is much higher potency than what you would find online or on the shelf. And even if you buy those types of products, you also run the risk of getting a product that wasn't manufactured right. And a lot of patients will tell me that, oh, David, I bought CBD products. They didn't quite work for me. And 90% of the time, it's just a product that wasn't made right. Whereas with ours, we oversee the entire product. It's a roll-on balm. There's a ball applicator, so you can apply it anywhere locally. It works in a two-stage process. Almost immediately to within 5 minutes, you'll get kind of a warm numbing sensation like a Bengay or an icy hot, and then in about 15 to 20 minutes, you'll get that CBD pain relief effect, and it will last longer. And my story with it, I used it myself as well. Also, mountain biking, so I strained my wrist, and I happened to go to the bike park the week after, and I rubbed some on my wrist, and it was great. It was really good. So definitely a product that a lot of even our own patients use. You can get at the clinics. You can give me a call for that. But yeah, any other questions or anything, you can always feel free to reach out to me. Just think of me as kind of your reference for MMP and someone to kind of talk to about any potential issues rather than kind of waiting in line at the dispensary or even kind of trying to research all this stuff yourself, because it is a little tricky. But yeah.
Well, first comment I have, Dave, first of all, thanks for that very thorough, in-depth piece about the educational component that you oversee. Well, I think perhaps you and I may need to take up road biking instead of mountain biking, at least in the winter months, so we're not depleting all the supply of sauna that's available to our patients. But I want to pick back up on one of the things that Dave mentioned, because I think it's super important for all of you out there to consider, and that is the Strain Genie kit. Think of it as almost like an ancestry test or a 23andMe test. Again, it's just a swab of the inside of the mouth, some buccal saliva. You send that in, and then within 6 to 8 weeks, you get your results. What's nice about this is it really hones in on and targets what we are very, all about here at NASPAC in terms of it being personalized medicine. So you'll never get as personalized medicine as you will with your own DNA, right? So this allows us to identify what strains may work specifically for you, hence the Strain Genie name. But moreover, can identify strains that, may take you weeks and weeks and months to find yourself. So you're really sort of cutting through the chaff, so to speak, and going straight to what we know, what we've clinically proven genetically is actually going to work for you. So based not only on the limited time resources that a lot of the dispensaries have, but just on the trial and error component, purchasing a Strain Genie kit may well be the most easy, a comprehensive and direct way to access the product that's going to work best for you.
And to also add on to that, when you do the Strain Genie kit, it not only gives you the perspective that you need, but it also gives us the perspective as well to kind of help you along those lines, because a lot of times patients will give either myself or Dr. Slevin a call and kind of go through what they're taking and whatnot, and we reach a certain limit where we just don't, we'll kind of be stretched a little too thin because we don't know exactly kind of how your body is taking up to specific cannabinoids and terpenes, right? So this kind of gives you that final extra leg or extra mile, however you want to call it, to essentially just kind of zip through the process. And also, the other thing that I wanted to mention as well is some patients will sometimes think that they are using the best products, but in reality, there might be products that are even better for them, that maybe they just haven't been exposed to or even know about. It might just be a product that they kind of glance past at the dispensary every time that they go to, and in some cases that can actually save them money over the long term. Like maybe they're so accustomed to smoking flower, but maybe topicals or even edibles that are cheaper in some cases might be even better for them, right? So it really fine tunes how you can kind of see yourself in the MMP program. And the last point that I wanted to make with that is the journey to get to your MMP card is already a pretty pricey and a lengthy one. So it's always good to know that you're kind of at the top of your game and you know what's going on as well.
And certainly, quality is always key. And just remember that whatever you get through the medicinal marijuana program, and whatever you get through NASPAC and the sauna in terms of our CBD balm, are pharmaceutical grade product versus what's available elsewhere. So I think that's also something to keep in mind just as we move into the era of the decriminalization, at least in the state. It's still federally a Schedule 1 product, which means that there's no medical use for it. We know that that's not the case, and there's data to support that. And many states across the country have actually brought in their own laws to allow for recreational use, New Jersey being one of them. So we're anxiously awaiting the specifics of that legislation to be introduced and what it actually will mean to those of us on the ground in the medical marijuana space and community. But something I think definitely to keep in the front of your mind as we move into that new era of recreationally available cannabis in New Jersey and elsewhere is the quality. And you always want to be mindful of what you're ingesting, what you're inhaling, etc. And you want to make sure that, like any medication, you're getting the highest potency, highest quality, lowest additive type of product that's available on the market. So
I want to speak to that point a little bit as well, Dr. Slevin. So the important part that most patients don't know about is that you as the patient, when you go to the dispensary, you have every right as a patient to ask them for lab results and also basically informational sheets about the products. So let me give some good examples and feel free to shed more light on it as well. So I'll give a couple examples. The first one is basically when you look at the different products, you want to know that what is being advertised on the label or what the dispensary is telling you matches what is actually on the lab results. So because marijuana is a plant, it's grown just like any other plant, and it can be grown in a multitude of ways. It can be grown indoors, outdoors, it can be grown with insecticides, chemicals, or it might not, right? But all of this sort of stuff translates to the end product. So say a product is advertising, say 20 milligrams of THC or whatever, how many milligrams. You want to make sure that that matches exactly with the lab results and doesn't have too much of a kind of a delta between what is actually advertised and what is actually in the product. Because patients that are new to MMP and they buy products and they go home and try it and it doesn't work for some reason, it's not that it's just not working. It's not that their body's not taking to it. There can be a lot of different reasons, and it's always important to kind of work yourself through this mental checklist of everything before you kind of call it quits, which many cases shouldn't be the situation. So that's that. The other part is it kind of falls in line with the first example is, say, for example, a patient is smoking the same Blue Dream month over month over month over month for 10 months. It's working. And on the 11th month, they buy the same product or what they think is the same product, and they go home and smoke it, and it doesn't work. Once again, they might immediately think, oh, something's wrong with me, or maybe the product's not working, the program's not for me anymore. But go back and look at the lab results. In some cases, it might have come from a different batch, a different grower. It wasn't manufactured correctly. If it's like a topical or an edible, those sort of things really come into play, especially since even like CBD products are so relatively new to the market. You really want to be very careful of what you're getting, where it's coming from. Otherwise, you might just be paying for very overpriced lotion or gummy bears or what have you. So be very careful of all the lab numbers on it.
And also just on that point, remember that, again, the pharmaceutical grade quality that you will get from something like Sana versus what you may buy, at the Wawa or the Target, you just are not comparing like with like. It's almost like, a brand necessary or brand name medicine versus a generic. The generics have the ability to alter up to 15-20% of the components of that medication and replace them with other agents other than the parent compound, the parent drug, that may be less effective and in many cases are less effective. So the same is true of the medicinal marijuana. Having access to pharmaceutical grade means you're getting the highest quality, essentially the brand medically necessary, as opposed to the generic with all of the other components, debris that may just not be par commensurate with the rest of the actual medication. So it's a way that the medication can be diluted so that the generic can last longer and be stretched out by manufacturers. But in the medicinal marijuana arena, what you buy at the dispensary, what you buy through North American Spine and Pain is all pharmaceutical grade.
Right. Perfect. And I think at this point, maybe we want to take on some questions.
With that being said, absolutely. We have a first question that comes from Stephen. And Stephen's question is, do you need to be a pain management patient with North American Spine and Pain to go through our program? Well, Stephen, certainly you have to be seen by one of our providers. In terms of the diagnosis, you don't necessarily need to be a chronic pain patient. You could be a patient that has some of the other diagnoses, but you also can come through our practice. So whether it's anxiety, muscle spasm, intractable skeletal spasm, or any other type of the diagnoses. There are other diagnoses, more esoteric ones, more unusual ones, such as ALS, that's Lou Gehrig's. There's also diagnoses that are accepted. Tourette's syndrome, which falls under psychiatric diagnoses. So really it's a matter of what's readily available for you. My advice would be to check the state's website, see if one of your diagnoses meets the criteria to be registered as a patient. And if you do, you certainly can come into any one of our 17 locations, call the number, the hotline or 800 number, and let them know you want to make a medicinal marijuana appointment for a new patient evaluation, and we'll get you taken care of and seen. We'd be happy to help.
Perfect. Feel free to take the second one.
So next question comes from Nicole. Appreciate that, Nicole. I found that microdosing indica gummies works quite a bit for CIDP, chronic inflammatory demyelinating polyneuropathy flares. You were surprised. You're interested in topicals, but unfortunately your dispensary doesn't carry them. So I'm going to have Dave speak to what we can sort of help you out with in terms of identifying certain dispensaries that may have certain products. That's one of the services that falls under our educational and support arena. But quite simply put, I think you raise a good point. And if I were you, I would share this information, or perhaps you've learned it from other forums. But I think this is a really helpful piece of information to have for patients with CIDP, which can be a very debilitating condition, and in many cases is really difficult to treat. So you've done some of the heavy lifting by yourself and found that the microdosing of the indica strains and indica products was actually helpful. So first off, kudos to you. Share the information, share the love and the wealth, because that's what it is. You're helping out others in a community where access to appropriate, efficient types of therapy can be extremely limited. So like I said, I'm going to punt this to Dave for further commentary on topicals and what's available and how we track that.
Sure. So thank you, Nicole, for the question. And just like Dr. Slevin said, you can always feel free to reach out to me. We'll put my contact information there. But one of the other things that might always be helpful that's available to you right away is look at the different dispensaries in your area. Like maybe it's one that's a little bit further, but I can speak to this because not all dispensaries will carry the same products. It's not just like Tylenol or Motrin where you can just go to any Target, Walmart, Walgreens, what have you, and you'll know it's on the shelf. It's a whole different type of product selection, and what you can do is all dispensaries will have online menus, and you can check online or even give them a call first to see if they do have the products that you're looking for, in this case topicals. So I would try that, and then also, like I said, in conjunction, if you want to give me a call or reach out to me via email, that's perfectly fine as well. I can help you along that track as well, especially if you have other questions. Let me take the next one. So this is from Bob Rifkin. He says, I don't want to get high. I just want pain relief. How effective is it and how long does it last? Do I take it in conjunction with my current pain meds or in place of them? I'll let you take the second half, but let me answer the first one. So you don't want to get high and you want pain relief, and how effective is it and how long does it last? So I'll answer it this way. So between medical marijuana and hemp-based CBD, you do have potential with both, and here's why. And I always tell patients this as well. Whether you use straight medical marijuana products and or CBD, I always say think about the environment that you're in and also the time of day that it is. For instance, if you are, say, driving or going out and about and seeing family and friends, going to work, then medical marijuana might not be suitable. It actually is not suitable for that situation. CBD is, because you won't have any potential impairment or whatsoever. Now, if you're home and say you have insomnia and you want to use a product before you go to sleep, or you're home and you're relaxing and what have you, then medical marijuana is great for those types of situations because it can get you the pain relief and it'll get you kind of an additional factor of feeling relaxed as well. Now, to your question about not getting high, feeling high is basically, think of it as kind of a THC threshold. So if you take a proper journal and you write down everything that you're taking and how much you're dosing with and all that, there is a potential for you to get the pain relief that you need from, say, medical marijuana without breaking into that threshold and feeling high or impaired or what have you. With CBD, that doesn't really exist because there's no impairment. But with medical marijuana, if you go down that path, then you always want to start. I always tell patients that it's better to start off small and not feel anything, or maybe feel a little bit because you know how to work your way up, rather than kind of diving head first into it, using too much, and then kind of having to work your way down from it. And then how effective is it and how long does it last? So that really depends on the types of products. So as stated before, if you're smoking it, usually effects will come in about 15 to 20 minutes and last around maybe say 3 to 4 hours on average. If you're eating it, effects will take a little longer, come in around maybe the 30 to 45 minute mark on an empty stomach, 45 minutes to an hour plus if you've just taken it after a meal. And then with topicals, comes in around 15-20 minutes for effects, lasts around maybe 3 to 4 hours, maybe a little longer if you're less active, much shorter if you are very active. So one of the things to piggyback off of that is to be very, very mindful of those rules. An example that I'll give before I turn it over to Dr. Slevin is I have a lot of patients that call me and say, oh, I took too much of edibles and whatnot, because they're not, they forget the time that it will take for you to feel effects. So most of them say if they're used to smoking, they're used to getting those effects in about 15 to 20 minutes. And when they take edibles, they think the same thing. And when they don't feel anything in about 20 minutes, they'll take more. So edibles have a pro and a con. That's fortunately and unfortunately the same thing, is that it lasts longer because your body is digesting it. It will take a little longer and the effects will last longer. But if, say, you take double, then the effects will compound at some point and they will last longer as well. And at that point, there's just basically nothing to do but kind of wait it out. So be very mindful of how much you're taking. Be very mindful, especially for medical purposes, to take just the right amount so that you can have it basically last the intended, give you the intended effects and also last the intended time as well. But yeah, let me pass it over to you. So like as stated, Bob wants to ask that can you take medical marijuana and or CBD with current pain meds or in place of them?
That's a great question, Bob. And the real answer is you want to take it in place of, because much like the oxycodone, I'm going to just use some pain medicine examples that you may or may not be familiar with, but certainly you've heard of. Oxycodone, hydrocodone, morphine. The body has opioid receptors, much like it has cannabinoid receptors. So the opioid receptors vary, depends on which medication that the patients or that you're exposing yourself to. So if you're taking oxycodone or hydrocodone or morphine or any other type of opioid, the body can quickly become adapted to and the receptors saturated with the medication. What that basically means is that the medication isn't going to work as well. So typically after 6 weeks, certainly much less than 3 months, the medication, if you haven't changed it, either by rotating to a different one or altered the dose or added a nerve pain medication, a neuropathic, you're really not going to get the same effects that you once got. You're basically just sort of meeting your tolerance. We can become tolerant to all types of products, from caffeine, nicotine, alcohol, pain medicines, and certainly MMP, medical marijuana, and the cannabinoid receptors are no different. So giving the body, all that to say, giving the body a different stimulation, a different boost through a different pathway, such as the THC or CBD, the endocannabinoid receptors, and that pathway, is really giving your body a whole new access to a totally different mechanism for pain relief. Because much like all the other receptors, all of the endocannabinoids, the THC, the CBD work differently in the nervous system, same way as the pain medications work differently. So if you swap one out and add in a new molecule, you're just going to be getting a better combined overall analgesic effect. Now there is some element of trial and error to that, and we will oversee, advise, and consult as you go through the process of trying to replace some of your prescribed medications with medicinal marijuana. But I'll tell you, in my experience, and this is across, I've discussed this with all the providers in the group, and we've all had, experiences that are very similar. Approximately 70% of patients are able to reduce their opioid intake by up to 50% or more. Some patients have come off totally, but it's more than a placebo effect. It's more than, I think this might be helping. Scientifically, it actually does work, and patients are able to reduce their overall opioid intake relatively quickly. So great question. Hope that helped.
Okay, so the next question is, what can I use for herniated disc in my back and sciatica? This comes from Tamika Jackson. I'll let you...
Hey Tamika, thanks for the question. Another great question. It's a very common diagnosis that we treat here at North American Spine and Pain. Herniated disc, sciatica, one leading to the other, right? The disc causes the sciatica. We typically will treat that none with and without medicinal marijuana. We obviously want to solve the problem, right? We want to get rid of the sciatica, get rid of the bulging disc. So a treatment plan may look like physical therapy, X-ray, MRI, some epidural injections, neuropathic nerve pain medication like gabapentin, pregabalin, Lyrica. And at that point, after what is considered conservative and minimally invasive therapy, if you're not better, I mean, if your pain hasn't gone away fully, then we're going to recommend perhaps a minimally invasive spine procedure, a percutaneous discectomy, where we go in through a needle and pull out through the small forceps the offending piece of the disc. This can all be done through an incision of about 1/8 of an inch under sedation anesthesia, much like twilight like you would get for a colonoscopy or an upper GI endoscopy. Medicinal marijuana will certainly help. It will certainly help treat the pain so you don't experience the painful stimuli as much, but it isn't going to fix the actual lesion or problem structurally that's causing the pain. But certainly the medicinal marijuana could take the place of the nerve pain medications in the treatment program. But our goal would always be to relieve you fully of the pain and so that you could come off all those medications and come off the medicinal marijuana as well when appropriate. Thanks for the question.
The next one is from Denise. She states that she has a spinal cord stimulator and the company went bankrupt, unfortunately. And she has a lot of pain from the lead. And she's been told by a lot of people that she should try it. You want to take this one?
Yeah, Denise, sorry to hear that. I'm familiar with the company in question that you're speaking of, Nuvectra there. Unfortunately, just couldn't survive in a tight market. Certainly it was a huge disappointment to all of us that had used their product over the years, myself included, and an even greater disappointment to patients such as yourself. So first off, if there's anything that we can do in terms of seeing you for an evaluation or consultation, just to advise on what your options might look like regarding the lead, how it could be removed. It can be under certain circumstances. The battery can be, to be left in sort of hanging like that is very unsatisfying. So feel free to reach out to us. We'd be happy to advise on that. Now, the specific question in terms of medicinal marijuana for lead pain coming from a nerve lesion or an irritated nerve, what we call neuropathic, or pain that's caused by an irritated nerve, absolutely. There's good data, good science that supports the use of medicinal marijuana specifically for neuropathic pain. And let me just add that neuropathic or nerve pain is particularly difficult to treat with what we consider standard pain meds such as Percocet, Vicodin, morphine. They really do a bad, terrible job, ghastly job of actually treating nerve pain because they're not designed to treat nerve pain, because nerve pain is its own specific animal, so to speak. But neuropathic pain is something that can be treated with medicinal marijuana. So we'd be happy to advise further if you want to have a consult or reach out at any point to discuss the stimulator. Wonderful. Thanks for the question.
Next question comes from Jennifer. She asks, is it possible to find out if you're allergic to marijuana? I started having pretty severe allergic reactions, tongue swelling after vaping for about a year or so. The dispensary I was going to told me some people are allergic to different strains. I actually developed some food allergies around the same time, but when my allergist or immunologist was testing me, she said that there wasn't any test for marijuana yet. So to speak to this, you want to be careful because yes, there is a potential to be allergic to some certain strains, but also say if you're taking a different type of end product, right, whether it's like an edible or a vape or a tincture, there might be some additives into that you might be allergic to. So always be mindful of all of the different types of ingredients that's in the product that you're taking. And I would say here, and the final step, or maybe another step that you want to look at, is if you are very concerned about that, if you take, say, like the strain genie test, that would be a good alternative for you to kind of find out what's going on, but also just to kind of get down to the bottom of what type of strains would work best for you, so you don't have to kind of keep on trying, especially since you're already having an allergic reaction to some that you're trying kind of in this trial and error process.
Hi Jennifer, I was thinking the same thing as Dave. Absolutely, I think Strain Genie is the way to go, and we can certainly discuss that at an upcoming visit. Thanks for the question.
Okay, so the next question is, if I don't like taking pills, would this be a good alternative? Also, Lexapro, would that interfere?
So certainly this is a good alternative if you don't like taking pills, whether it's, you're unwilling or unable to. Many people just have difficulty swallowing large pills. It's a real phenomenon. So yes, it's a very good alternative in that setting because it can be ingested, as we've discussed, through oil, topically, flour, vape, tincture. So that's number one. I think you're onto the right, certainly onto the right approach with the medicinal marijuana. Regarding Lexapro, good question. Strain Genie is your friend here, right? We want to identify and just avoid you having to go through, the trying to find the sort of quote unquote needle in the haystack. Again, we want to minimize the risk for any adverse events. Lexapro is used for a rather narrow list of diagnoses. We don't want to make any of those diagnoses worse by having you go onto a strain of something that is just not ideal for your genetic makeup. So if we're able to identify that in advance, then we can give you the best possible information, give you really personalized medicine, and give you the best possible advice so that you avoid any potential pitfalls in your Lexapro treatment. But certainly, like I would say to anybody, any viewer, please be mindful and consult with the prescriber of any medication that you're currently taking ahead of participating in and starting on the medicinal marijuana program, just to make sure that everyone's on the same page, first of all. You want to make sure that all of your providers are knowledge based on and informed on what you're taking. But if they have any other concerns based on what they're prescribing, that gives them the opportunity to give you that advice. So keep us all in the loop.
Perfect. And then another question that we have is, or a statement, I just hope that the laws change on a federal level so insurance can recognize medical marijuana as a medication and cover it just as any other prescribed medication. It's just unfortunate for many people who can't afford it on disability. So yeah, I'll speak to this first before turning it over. So one of the things that I mentioned at the beginning of this session is kind of what I call a magical formula, right? So a lot of patients will immediately think that, oh, medical marijuana is very pricey, which it is. It's unfortunately not covered by insurance, so you'll have to pay out of pocket for the appointments and also for the product as well. But in certain cases, and in many cases with patients who do want to hopefully replace their regular medications with something more all natural, or maybe use them in conjunction, what have you, you want to be very, very mindful of how much you're spending per month, obviously. So that's kind of what I do with patients, is really give them the advice and the recommendations of what to get and how to start off with dosing, so that at the end of the month or end of every month, you're not kind of wasting product or throwing it away or just taking too much. Because as stated, a lot of patients will think, oh, I'm taking the highest strength of my oxycodone, that means I need to go right to the dispensary, buy up to my limit of 3 ounces, and then go home and smoke it all in a couple days or what have you. That's absolutely not the case whatsoever. It is very possible to get a lot of pain relief and also ailment relief from medical marijuana on a much, much lower budget as well. So as stated, even though the average kind of monthly allotment is 2 to 3 ounces, I would say a very, very large percentage of patients don't even need to hit that. And it's all about kind of just tracking everything with a journal entry of what you're taking, how much you're taking of it, and how you feel before, during, if you can jot that down, and then how do you feel after, right? Because in some cases you'll find that it is a little bit more quote-unquote freeing than some of the potential side effects that you'll get from, say, like an oxycodone or something else.
I want to just jump in on that. I think, Dave, you make a good point. I think I agree with the viewer that it is a shame that this hasn't been recognized at the federal level. I think we're going to see that change over the upcoming 3 to 5 years. I think certainly once that happens, insurance carriers will be forced to pay for this because the data supports it. This isn't just some fad that's, spreading from west to east the entire length and breadth of the country. It's actually science-based, and we know that it works. So whatever pushback there may be from pharmaceutical companies, et cetera, all of us are in this together to get patients the best access to care. And in terms of the cost, we're mindful of that. We will work with you on an individual basis in that regard. And I just want to say that all of us at North American Spine and Pain are incredibly happy and proud to take all insurance coverage here. We take Medicaid, Medicare, commercial plans, workers' comp, and auto. The only place that I've seen where patients have had some success is in a litigated case, perhaps through workers' comp or auto, where on the very individual basis there, if your attorney, typically patients with workers' comp or auto are represented by an attorney for some, stage of the process, your attorney may or may not be able to get it done. But I have seen a couple of cases where patients have had their carrier reimburse them or reimburse their caseworker their case based on their diagnosis, because again, this works. So what can you do for that in that regard? You can call your senator or your congressperson. Let them know that you're an advocate for medicinal marijuana. If you've had a positive experience, let them know that you're an advocate for medicinal marijuana. Share your voice. Let your voice be heard. Share your story. It's only going to help countless others, much like Nicole's situation did in her arena with CIDP. We do want to share some new additional information. We have a very exciting tour tomorrow to the dispensary, the cultivation, grow house, etc., over in Belmar, and we want you all to come and watch. We will have behind the scenes footage available on Instagram, on Facebook. Look for NASPAC MD, NASPAC Strong, and look for us to get some more information for all of you. That's why we're going, so we can learn and share whatever information, whatever tidbits we can find, and we'd be more than happy to share those with you on the various social media platforms. So please check that out tomorrow.
And then a couple of points before we wrap it. Ryan, if you can scroll up a little bit on the...
Laura had a question.
Yes. Yes, so Laura Lynn has a question. She asked, do you recommend getting the DNA test for which strain is best? So as stated before, if you're tuning in later, that's totally fine. So totally recommend it, because it does one of two things. One, it gives you kind of a breakdown of any potential medical risks that you might have prior to using medical marijuana, or even if you're already using it in the midst of it, that's totally fine. It might uncover stuff that you haven't realized yet. And also, as stated, you get a cheat sheet of essentially all of the different products and the strains that would be working best for you. So it's highly recommended. It can't hurt in any way. It basically just gives you the peace of mind that when you're going to the dispensary, the money that you're spending on products is definitely going towards the best ones that will go that will basically work with you. And then the other point is to the unaffordability. Like I mentioned before, one of the things that does potentially save you some money is if you are, say, on Medicaid, Medicare, disability, Social Security. Each state, New Jersey, Pennsylvania, have the potential for you to get a reduced fee on the card. So that kind of saves you a little bit of money there as well. And as said before, you can always reach out to me. I can help you kind of with the recommendations and the advice, and that in and out of itself might help you save money from just kind of potentially buying products that you might not need to.
Just to take up on that a really good point, Dave. The time that you need to mention that when you want to get the discounted rate through the state is when you go for the initial visit for your MMP to get certified by the physician. You want to let the physician know that you would like the physician on your behalf to request that you get considered for financial hardship. If you're on any type of disability or any government or state funding, that's the time to let the provider know, and we will gladly put that in on your behalf, certainly. In fact, it's on our checklist. We ask all patients at screening if you're receiving any type of assistance so that we can help drive down the costs to you, the patient. Laura, just a word of advice. Try not to let the pooches get access to it. I can't imagine what that would look like. Medicinal marijuana for the pups.
One other point that I wanted to add, since you mentioned previously, let your senator know and congressman and what have you. Also let your community know as well, if it's possible. I know a lot of patients come to us and they trust only us, and maybe they don't feel comfortable sharing it with their spouse, their loved ones, their family, their friends, maybe their work as well. But that, in some cases, might be some of the strongest information that you can share, because outside of this whole conversation, marijuana in and out of itself is still, as a whole, potentially looked down upon, right? There's a lot of stereotypes, there's a lot of stigmas with it, and that's kind of what a lot of patients are faced with before they even think about stepping into the program is like, is this safe, or is this for me? What will so-and-so think about me if I use this? I have to hide it from my kids. So like they have to find out all these different ways to not acknowledge that they're using it before they use it, and sometimes that's the biggest hurdle for you to step over. So in addition to, like stated, letting your senator or congressman know, also let the people around you know as well if you're comfortable with that, because that can also start a whole kind of movement and a bigger ripple effect than you might think.
I agree. The more that people know about something they're not familiar with, the more they are, to generally be okay with it and accept it. And destigmatizing the use of medicinal marijuana can only be a great thing for the entire community and all of us out there that are working so hard to support patients who need it, who benefit from it, and whose lives have been changed for the better for it. So I couldn't agree more with Dave in that regard. Help to demystify medicinal marijuana, talk about it, let people become informed and educated about it. That's the only way that we're going to continue to make the progress that we've made and continue to see greater access to medicinal marijuana throughout the tri-state area.
Perfect. Ryan, do we have
one comment from Denise? Denise had something to say about the practice. Hey, Denise. Denise said she had great care with us. Hey, Denise, at North American Spine and Pain, we're very happy to have you as a patient, and appreciate you letting us know that. It's our pleasure to help take care of you. Okay, Nicole got a reduced card fee. That's good. It is certainly expensive, and you need help getting the dispensary. Yes, certainly. Well, hopefully that help is actually.
Oh, one point that I wanted to make on that as well is if you do have difficulty going to a dispensary, one of the things that you potentially could look into is if you do have someone that can take you and potentially can help you purchase products, there is an option to have someone sign up as a caregiver. They don't need to be a patient themselves. They're basically just linked to you as obviously stated, as a caregiver, and they go through kind of very similar process. Obviously, they're not getting the product for themselves, but they're essentially noting down that they're getting the products for someone else, and they go through kind of a screening process. They get a card themselves as a caregiver card, and then they can essentially just go into the dispensary and purchase products on your behalf. So lack of mobility or limitations in getting to the dispensaries is something that doesn't limit you from getting the product anymore. So that's one of the things that we wanted to mention as well.
Exactly. Thanks, Dave. And, I think my final comment is, just to go back to the destigmatizing. We also, as you know, as one of the earlier comments was regarding whether or not it had to be a pain diagnosis. It doesn't. This is also indicated for anxiety, for depression, really common diagnoses. We've all been going through it for the last year. We've been through the ringer. So if you are suffering from any type of mental illness, anxiety, depression, insomnia, speak up, speak out. Help is available. We have a psychiatrist here on staff at North American Spine and Pain, Dr. Julia Quinlan. She's a phenomenal physician, has extensive experience in this space, and her skills are a wonderful asset, a huge resource to all of us in North American Spine and Pain in making us a better practice to serve the needs of our community. So again, it's all about normalizing what has essentially been a very abnormal year for all of us. So if there's anything that we can do in that regard to get you access to mental health care, or if your diagnosis is from the anxiety, depression, insomnia list, then reach out. Help is at hand.
And then looks like we have a final comment from Kathleen. She's very happy with Dr. Falcon. She's very thorough and informative, and she actually has an appointment tomorrow. So Dr. Falcon is great, and during your appointment, definitely mention that you watched this on Facebook Live. She'll probably get a kick out of it, and then if you do have any questions, or if you want to get the sauna bomb or the strange gene test, let her know about it, and any other questions that you might have, she'll be able to answer, kind of pass them along to either one of us.
I agree with Kathleen. We're all very happy with Dr. Falcon. She's great physician, great addition to the team, serving the shore areas for NASPAC. So we're in agreement there. A couple of final comments before we wrap up. We're into our last minute, I believe.
Yeah.
So helps with sleep. Nicole gets some help at sleep time. If I come in for consultation, is there a written checklist on price? We can give you access before you come in on our fee structure, sliding scale, fee schedule. And I believe that at the dispensaries, you have to call them directly. Last I heard, they were charging, up to $100 per eighth. That would be the higher end, but hopefully competition will drive those prices down and it will become more affordable for everybody. And certainly when it becomes medicinally available or becomes recreationally available, we'll still see it being more affordable, but we want to make sure that the quality is there as well.
I want to touch on that real quick. So, there are a lot of patients that are anxiously looking forward to it being available recreationally. However, it does come at a caveat. So if it is like anything like, say, Oregon, Colorado, or California, what usually happens is those with medicinal marijuana cards will be able to have access to higher strength products and also lower prices versus with recreationally, because you're coming in, say, kind of off the street and you don't have a kind of interaction with the provider or what have you, just kind of going in and getting it on your own accord. Usually the strengths are lower, but the prices are higher as well. So be mindful of that. It may or may not happen in New Jersey, but if you're looking at historical data, that has a potential of happening. And the other thing that Dr. Slevin mentioned is if you're interested in getting a price list for products, look at your local dispensary, go online to their website, and they'll usually have all the prices for you. So you'll be able to kind of see what the quantity or the amounts of the products are, what flavors, what strengths they are. You'll see the pricing of it. So you'll get basically do your own research before even coming to us to get the card, rather than kind of vice versa, getting the card first and being shocked at the prices. So a number of ways to kind of take it on, but that's one of the things that you can do.
Thanks everyone for joining. Thanks Dave for flying in from California to appear live here with us at Hainsport NASPAC headquarters. We're delighted to have him here for the rest of the week. And nothing remains but to wish all of you a happy holiday season. Stay safe. Have a great holiday with your families and be well.
Thank you so much, Dr. Slevin. And then one thing, if we can just put on to the screen for maybe, say, a couple minutes or so, maybe our contact information. So our 800 number, and then you can put in my contact email, phone number as well.
So we have info@naspacmd.com. www.naspacmd.com is our website. We'll get that information. It's a great idea. We'll get that information up. One of our phone numbers is 609 at Hainsport, 609-845-3988. We will post the 800 number in the comment section right now, so everyone has access to that. There it is. And Dave, you want to shoot your email?
Sure. So my email, if you have questions directly with like MMP or sauna or CBD and you want to purchase the sauna, my direct office extension or phone number is 856-599-5445. That's 856-599-5445. And my email address is Nguyen. It's on the screen at naspacmd.com. You can feel free to reach out whenever.
And you did hear correct. It is an 856 number, but he is in California, just so you know. So don't call him at 9 a.m. Eastern. It might be a little early Pacific time.
But you can call me at 9 o'clock at night here, and it'll be 6 o'clock for me. So you can feel free to call me. Just be mindful of the time difference, and I'll be mindful of the time difference coming along over as well.
NASPAC goes transcontinental. I always wanted to say those words.
Once again, thank you for joining us. Thank you, Dr. Slevin, for the time. Thank you for joining me on this. And stay tuned. Tomorrow, we're going to go to Curaleaf. We're going to take pictures and photos of both the dispensary side, so you see what's going on inside, and also their cultivation side, so you'll kind of know what's going on that side as well. And we'll be basically pumping out a lot more content. Make sure you check our website as well, because we're going to be building out a full blog of just articles, video content, and if you have any other ideas or if you want us to cover anything, shoot us over an email, call us, let us know, because this sort of information is quite beneficial to the community. And the last thing is not even about just medical marijuana, but if you have any other questions about like pain or anything like that, give us a call, schedule an appointment, come in and see the wonderful Dr. Slevin or any one of our other providers as well.
We're here to serve, guys. And we'll see you tomorrow. Look for more information from the Grow House.
All right.
Looking forward to it.
See you, everyone.
Good night.